Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Jessie Mahoney, pediatrician and coach. Today's Kevin MD article is Why Physicians Struggle with Caregiving and How to Cope with Grace. Jessie, welcome back to the show.
Thanks so much for having me.
All right, what's your latest article about?
So, this article is about caring for aging parents as physicians. And I wrote it because I'm caring with my own aging parents. And I notice very often that a lot of my physician tendencies make it harder. And my best friend from medical school is a geriatrician. So she is always advising me about the medical part. And what I realized was that so much of the mindset part is also the problem. And so if I look back at all the things that make me a good physician, they don't necessarily make me a good daughter caring for my parents. And a lot of these tendencies, like I will say over responsibility and taking things on that aren't mine, and maybe over personalizing whether they take my advice or not, actually make the situation much more challenging than it needs to be. And I hear from so many others the same thing. And so I thought it was worthwhile having a conversation about this idea that being doctors actually makes it harder to care for our parents. And yet we are the ones who are generally in families tasked with caring for our parents. I'm the only child who's a physician and also the daughter who's a physician. So you generally then land in that role by default. And my brothers are perfectly happy to let me take on that role. And yet it brings all these other layers that get in the way.
So, talk to me about some of the challenges that you're facing, perhaps because you're a physician caring for your parents.
Yeah, I think one, I feel like it's my job. And it's not actually my job. It's sort of a self-appointed job or appointed by others in the family. But one, it takes a ton of time. And most people who are practicing medicine don't have a ton of time. The over-personalization one is a big one where maybe we make a suggestion and our parents don't agree with the suggestion or don't like the suggestion. And I used to take it personally. I don't anymore. I realize I have decided, and this is one of the thoughts that's helped me the most, is like when I'm in my 80s, I'm not going to want anyone telling me what I should do or not do. And so I don't shouldn't take it personally if they're doing that. But I think when you make a medical recommendation and maybe you know it's the best thing as a physician and your parents don't want to do it, we do take it as, do they not trust me? Do they not think I'm a good doctor? When it usually has nothing to do with that. I think also we often know what is best practices, and it's not really our job to teach them or educate them. It's really their own doctor's job. But I think we, especially with the chaos in the medical system, end up being sort of navigators or care navigators. And that adds this whole other layer that is really, really complex. And we tend to also be overfunctioners. I would be one of those, right? So trying to do all the things and take care of that and potentially taking care of the things that are not medical. And we don't necessarily delegate those to other siblings or other people who might be able to help. It feels like this sense of, again, over responsibility. The other layer that I find is just the guilt about things that we can and can't do anything
Mhm.
about, and maybe the limitations of the medical system. And I would say the limitations of the medical system today. It's really hard to get appointments. It's really hard for elderly people to get in to be seen, to use the technology, to write emails, and even to understand how to email your doctor and how to be an effective advocate for yourself. And so I find myself very often being the translator, which when you're also dealing with this emotional overlay of maybe grief about things your parents can't do or obvious sort of declines in the way things are going, it's really a complex situation.
And I think that's only compounded for those physicians where their parents may not be in the same city or even another country, right?
Yes, absolutely. And I think I see culturally, there is a sense that, it's our job to, as a way of respecting our elders, we should be saving them and doing all of these things. I see people hop on planes to go to India tomorrow and try to navigate everything. And it's really a challenge to do that, especially if you're practicing as a physician. And so, how can we separate out what's actually our job? Because really we're children and they're our parents. And so where's the line kind of between the love and the caring? Because we don't feel the same way about our patients. And yet I think we jump in and
Hmm.
many of us want to be the ultimate physician in that role. And that's sort of how we judge our ability or our value as a daughter or a son or whatever it might be. So it's really challenging, is what I'll say. And I don't think my article is to say it's not challenging, but I think even that recognition relieves some of the burden of it to
Hmm.
understand that, like, wow, this is really complex. No wonder I'm exhausted. No wonder I'm depleted. And to recognize that you're not alone, I think is really helpful. The other things that I think help are, for me, it's been mindfulness, like just the awareness and the showing up with a very specific intention about how I want to show up. Like, I want to be caring and loving, and that doesn't mean that I'm going to be able to fix everything. I want to be kind of in I like to think the advisor role or the consultant role. And they're not necessarily going to do everything that I recommend. So, seeing like what's the intention and what energy do I want to bring to the relationship rather than this reactive, here's a red flag, what are we going to do about it? Let me call all my expert friends and
Hmm.
figure it out, to be very clear what my role is and how I want to show up. And for me in particular, I think staying out of urgency, we always want to, we're fixers in medicine. And I'm like, oh, most of the things that are coming up are not urgent. They don't have to be decided today. And this one's been really helpful. My urgency isn't necessarily their urgency. And my urgency is certainly not my brother's urgency. And sometimes their urgency is not my urgency. Like they think that something's really important. My mom was really wanting to get glasses, right? And that's the least of the things going on right now.
Hmm.
But to her, it's the most important. So again, just sort of letting there be space between what I know medically and what would feel good to her. And so really, I like to ask the question, for me, it's like, what would peace do? And because peace is going to lead me to show up, but not overgive and not feel guilty and not burn myself out. I hope it's a marathon and not a sprint.
Yeah.
That would be the good outcome. And so, therefore, sort of figuring out how to manage my energy and make sure that I am not interfering with our child parent relationship. I'm not their parent. I think sometimes when we're the physician, we flip into that role.
Hmm.
And it's really about being very intentional, I think, and strategic, knowing the way we show up and what parts of that is going to be helpful and not.
You mentioned drawing the line to prevent you from being over giving and over caring. So for you, where is that line and how can one determine where that line should be?
Yeah, well, number one, it's really hard because most of us, right, medicine trained us to be overgiving and overcaring and sacrifice ourselves. But you really don't want to be burnt out on your parental caregiving. That's even more of a challenge than being burnt out on your other physician roles. And so I really ask, and I keep asking myself this question, and maybe it sounds a little morbid, but when all is said and done, I will want to feel proud and at peace with how I showed up. And so I usually say, like my future self, when all is said and done, will she wish I'd gone over today? Will she wish I had dropped everything? Or will she wish I had taken my mom to an appointment? Or will she wish I had asked my brothers to do it? And you can't always get the right answer because you don't know what's going to happen. But I consult my future self all the time
Hmm.
because I find that that's the most reliable way for me to have a compass about how to show up. And then sometimes I do consult my physician colleagues, but not for their medical advice, but like, do you think it's okay? What seems reasonable?
Yeah.
Because I think our sense of what's reasonable is a little bit warped. So it's really what we'd be able to sleep at night with when all is said and done, or asking myself the question, what would peace do, or what would caring do? Not this sort of self-sacrifice is not the above all, or being a
Yeah.
martyr child. That's going to really interfere with your relationship.
Now, some of the things that you mentioned goes into the category of self-compassion, right? Don't take things too personally and self-blame.
Yeah.
So how easy or difficult is it, or what are some things that physicians can do to give themselves more self-compassion when they're in that caregiving role for their parents?
Yeah, I think for me, it's we are exceptional at showing compassion to other people, but making sure we show ourselves as much compassion. And I think the easiest way for me is actually similar to how I use it in medicine, is to understand that when I practice self-compassion, you release oxytocin, you have access to your higher, wiser brain, and boy, is that needed now, right? I don't need access to my reactive, sort of unthoughtful brain. And so if you know the physiology of it, that helps. And it actually allows you to be a better caregiver
Mhm.
for longer if you practice self-compassion, as well as in the medical field as well. And so for me, I ideally want to be in this for the marathon, and self-compassion is actually the tool that's going to help you be able to do that. We rarely want to give ourselves, I call it grace and compassion, right? We feel like it's a pass. One of my favorite authors talks about self-compassion as a life raft for turbulent times. And I remember that phrase a lot
Mhm.
because medicine's full of turbulent times,
Yeah.
and caring for aging parents is by definition a turbulent time. It's something that, we were never taught in medical school or how to care for loved ones. And it's becoming more and more of an issue as people are living longer and longer. And so it almost feels to me like it needs to be some course for people who hit 50. How do we train them?
Yeah.
We did used to have something in our wellness program about it, which I think also is kind of my brain has, I didn't have aging parents at the time, but
Yeah.
now I do. And you can just really see how it's a very complex, nuanced situation where these default thought patterns and ways of approaching things as physicians makes it much more challenging.
And it's also a commentary of our healthcare system. In fact, that physician children have so much responsibility because
Yeah,
parents themselves don't have access to their own physicians, and like you said,
yeah,
can't communicate with their physician and can't get the answers, and it's so much easier just to lay that responsibility on their physician children.
yeah. When I if you come at it from a place of compassion for them and you, they're terrified, right? And so they don't know what else to do, whether my sense is also, I used to think that they sort of understood the burden, but they don't understand how the system works. They don't even understand that asking for your help, how that might interplay and what the complexities might be. I also see this, they want your help, but they don't want your help.
Mm.
And they're sort of torn in that. And you want to help, and you also don't want to help. You want to really leave it to their physicians. And I think it's a challenge. I I find also when you are navigating, it's how do you relate to the physician caring for them is like a third piece of the
Mhm.
triangle. And being respectful of your colleagues, and you watch your parents who are approaching it their way and not understanding the system. And then also we tend to feel guilty,
Mhm.
about the person receiving all their messages. And so, and again, I think that if we are aware and mindful and show up with grace and compassion, that's first of all, what we can do, it's what's in our control, but it's kind to all of our fellow physicians who are caring for our parents, kind to ourselves and kind to our parents at the same time. I think we bring also, I didn't mention this, but we bring our perfectionism and our, unreasonable expectations, and we want everything to be done just right. And yet we know in our current medical system today, that's just not
Yeah.
possible.
Any support services for caregivers other than your own immediate family?
Well, I think mindfulness and compassion is probably the best support services that you can find. And my dearest friend, who is a geriatrician, actually has done a lot of training on that and has done a lot of training on mindfulness for caregivers. So getting some kind of training and having a mindfulness practice is one of the most helpful things that caregivers can do. In fact, it's something I used to teach moms as a pediatrician, right? They would say, what can I do to help care for my 2-month-old, or how can I stimulate their development? And I would say, practice mindfulness.
Yeah.
And I think that this is the same thing because it allows you that space to respond rather than react. I don't think, I don't know of organizations that have, patient navigators or things like that. I think it's an area that somebody could really make a huge difference
Mhm.
in really helping us figure out how to navigate and utilize support systems out there. It's definitely an entrepreneurship opportunity for someone who is really interested or it's their passion. But for now, and it strikes me a bit as the same for now, as like how do we work in the healthcare system is leaning into being the best version of you and not taking it personally and making sure that you're not depleted, because when you're depleted and drained is when we don't show up as our best. And this is something that in the end I want to have shown up my best for.
We're talking to Jessie Mahoney. She's a pediatrician and coach. Today's Kevin MD article is Why Physicians Struggle with Caregiving and How to Cope with Grace. Jessie, let's end with some take-home messages that you want to leave with the Kevin MD audience.
I think the message of being aware that it's a really challenging, complex, and nuanced situation. So if you're overwhelmed and if you're feeling burnt out, you are absolutely in good company. And then to focus on what you can do and what's in your control, which the primary thing is to take care of yourself. I know we often say put your own oxygen mask on first. I would say here, at least put yours on as well. I think that we really want to put our parents on and really show up for that situation, but recognizing that our doctor tendencies may not be as helpful. So that awareness is really going to change the entire situation. And checking in with your future self. And so that you really want to feel at peace when all is said and done. And for me, that's been the most important. I will say not all is said and done yet, but that's helping guide me along the journey.
Jessie, thank you so much for sharing your perspective and insight. Thanks again for coming back on the show.
Thanks for having me.